So today I am joined by Dr. Marc McCleary. So the church probably knows him better as the husband of Holly McCleary, or originally Holly Massimilla. So how are you, sir?
I'm doing well. How are you doing, Bill?
I'm doing great, doing great. So you have your own practice in Illinois. How have you been affected by the virus?
Everything's different. As we were just talking about this yesterday. If you look back to 2 weeks ago to where we are now, it's crazy. Everything seemed fine. And then as far as in the practice and now, I normally see about 25 patients a day, and I'm seeing closer to 10, just people staying away. We started instituting appointments via video conference. So we use Zoom a lot at work to try to do appointments online, which it used to never be allowed to be a billable visit unless the person was in the office in person. Medicare, because of what's going on with the coronavirus, has changed that. So now you can actually do a regular doctor's visit over video, and we can bill for that visit, which allows us to kind of keep the doors open and kind of helps us mitigate a little bit of our lost revenue and our lost business by doing it that way. And it's also good because the patients don't have to come out of their house and potentially expose themselves to the virus. And if that continues after this, that could actually be a really big improvement to medicine in general that comes out of this, because this is something we've been pushing for a long time, and Medicare was always opposed to it, and now they've had their hand forced. So, but yeah, that's something that probably should have taken 6 months to a year to roll out, and we had to get it rolled out in 3 days. So, we're dealing with like the glitches of that and so forth, and I'm trying to figure out how to keep staff in there without having to cut their hours, even though we're not as busy. And also at the same time, on the flip side, a lot more conference calls planning for contingencies for when and if we have a surge in this area, and we all have to leave our practices to go into the hospital to treat their patients there. So it's busy, but in a very different way than it normally is.
Okay. So has anybody contacted you thinking that they have it?
Yeah, and so I see my normal clinic 4 days a week, and then on Fridays I go to what we call a respiratory hub clinic. So what we've done is we've asked patients who have any respiratory symptoms whatsoever to not come into our regular clinics, and we've created a special respiratory clinic that they go to that clinic. They're immediately masked as soon as they walk in the door, and then we see them in full gown mask and evaluate them at that point for potentially having it. And if we think they do, then we have to contact the state of Illinois to get permission to test them, because they still control all the testing. And then I work that clinic on Fridays. So I worked there yesterday, and I think we had 24 people come through, and we tested 5 or 6 that potentially had it. And there probably were some more that may have had it, but we just don't have the ability to test because they don't meet the criteria yet. But thankfully, in my regular clinic, I haven't seen anybody that I was overly concerned about, which is really the goal of that other clinic, so that we can keep the healthy patients healthy that come to see me for their regular medical follow-up.
Okay. So you just said, the criteria. What actually is the criteria then?
Well, it does vary from state to state. Illinois right now, the criteria is obviously if you're severely ill to the point of having to be hospitalized, you'll get tested. And they're really starting to move more towards testing almost all patients in the hospital who have respiratory complaints, just to, if for nothing else, to know they don't need to wear all of that PPE into a room of a patient who's COVID negative, just because we're in short supply. We don't want to use it when we don't need to. And then if you're not in the hospital, essentially you need to have the shortness of breath and the cough, and you also have to have a known COVID contact.
Okay.
Or you need to be working in a residential setting, like a nursing home, or you're a healthcare worker. So for instance, yesterday, the 5 people we got approved for testing, all 5 were healthcare workers, because we don't want people going back to work in the healthcare field if they have it, and then potentially spreading it. So, truthfully, because there's no treatment for it, if I think you have it and I can't test you, the treatment, what I would tell you would be exactly the same as if I tested you and you were positive.
And
And that's go home, don't leave. And so the only good thing about a positive test is it's probably a little bit more motivating for the patient to actually not leave if they know they have it, as opposed to, but that's essentially what we're doing. If they're positive or negative, is saying you need to self-quarantine.
okay. So are there any precautions that we should take? Like, I went to the grocery store, and, I've only been there twice, since this all broke. And when I went in this morning, every single person had a mask on. Is that something that we should be doing?
Yeah. Well, the CDC recommended yesterday that people that are going out, they should wear non-surgical masks or cloth masks. Coronavirus, by definition, there's several different coronaviruses. The common cold to coronavirus. It's not an airborne virus per se. It is a droplet virus, which means it can't be spread just from breathing, but it can be spread from respiratory droplets. That's why coughing, sneezing, that sort of thing makes it much more dangerous. Usually the size of the virus is so small that like a cloth thing won't help that much. But because we're finding out that, because it is a droplet thing, that actually does help a little bit. And so what they're finding out from the data from a lot of the Asian countries that are have been doing this for a few months before us, and so even if it's not specifically, we can prove scientifically that it's going to make a huge difference. It does seem in these Asian countries, especially places like South Korea and Japan, where I think the data can be a little bit better trusted than some of the stuff we're getting out of China, is that it does seem to help, and it's certainly not going to hurt. And I think early on people didn't want to say you should wear a mask because if you go out and everybody's wearing masks. But at this point, I think we're past the point of being unnerving. I mean, everybody is kind of stuck in their house. We kind of get it now, so like we might as well do it. And I know Holly went out to the store this morning and she wore a mask. First time she's done that. But why not? It's certainly not going to hurt, and it very well may help.
Okay, cool. Okay, so I'm going to kind of go and change a little bit, change speeds, unless you want to keep doctoring it up.
No, it's fine. We can talk about something else.
Okay, cool. Well, I want to stick with doctor stuff. I just want to kind of change. Okay. So here's some other doctor questions I have. So when you give an advice to a patient and you tell them not to do something and they keep doing it, does that happen a lot?
It does. And, my approach has always been, my job is just to tell you the risks. And for the most part, if I'm seeing an adult and they know the risks and they choose to do it anyway, that's up to them. I don't find it overly frustrating. Early on when I was maybe these things are not healthy, then you just realize that, people are generally just going to do what they want to do, and they're not going to necessarily believe you until they hit some sort of catastrophe, whether it be, the smoker who can't walk across the street anymore or gets lung cancer or something like that. Then they go, okay, now they're listening, or the person who has who is eating horribly and not exercising, and then all of a sudden they have a heart attack. And it's like, okay, now I'll start to listen. My job is to try to get them to realize that before it happens. Right. But, and I think people have good intentions. They want to do it, but it's hard. And if there's not that thing that's that big slap in the face, then, a lot of times it's not enough of a wake-up call. Just, this guy telling them what they already know, or they think they already know. So yeah, I mean, it does happen quite often. But, every once in a while, you'll have somebody and they think they it's true, but when I say it, they go, okay, you confirmed it. I need to do this. And so that's why it's worth keep doing it, because even if only 1 out of every 20 patients heeds it, hopefully that makes a difference.
Right. So when you were saying eating healthy and not exercising, you weren't talking about me, right?
No, I have no idea.
I know we've been friends for a long time, so I figured if anybody could say it, it would be you, right? I mean.
Yeah, I had no. You know what? I just ate some pizza rolls for lunch, so I'm a bit of the pot calling the kettle black here. So I'll keep my mouth shut.
Okay. Well, I mean, we can see where you're exercising right now. Oh no, you're in your bed, right? I mean, is that what's behind you? Your bed frame?
I'm laying in a bed. Yeah, this is about my exercise during quarantine.
Okay. Cool. Okay, here's other doctor questions. So, are there any realistic TV or movies about doctors?
So it's funny, and I think this is kind of a consensus across medicine, is probably the most realistic show for medicine was Scrubs. Yeah, and it kind of depicted a resident's life. I mean, obviously, some of the characters were over the top for, just for the comedy of it all. And obviously, I'm not vouching for all the content in the show, but as far as what it's like to be a resident, as far as what it's like to take care of patients in a hospital, it was actually more realistic than most of the other shows. Now, I'm not somebody who I haven't watched a lot of medical shows recently, but I mean, I know growing up, I used to watch ER, used to watch Chicago Hope, and then watched a little bit of House. Never really got into Grey's Anatomy or anything like that, but I can say that all those shows, while they were entertaining, and the farther I got in my medical career, when I would turn on a medical show, I'd be like, oh my goodness, I can't watch this. It's just so, and sometimes often the medicine that they talk about is correct, but the way things run in a hospital or the way things go down, just not accurate.
Okay.
And so, but yeah, Scrubs actually was very accurate to how it feels to be a resident, how it feels to take care of patients in a hospital. So yeah, that would be probably the most accurate medical show.
Okay. So, do you ever eat a really nice lunch and then have to go in and see somebody's really disgusting problem right afterwards?
Yeah, and I've never had an issue with like being grossed out by stuff. I'll be honest, maybe this is too much information. When I first started, the only thing that really bothered me was clean out people's ears and stuff that would come out people's ears. That for whatever reason, I found that completely nauseating. I've gotten past that now. That doesn't bother me anymore. Occasionally, there'll be a smell during a procedure where you're just like, oh my goodness, like I can't take that. But that happens less and less the more you do it. I had one a couple weeks ago where I was doing it, and my assistant was like getting really like almost sick, and I was like, what's bothering you? Like, she's like, you don't notice that? I'm like, no, I'm sorry, I'm completely oblivious to it now, And so it does. You sort of get used to it. But yeah, some of those things, it's like I'd rather do that at my 11 o'clock appointment than at my 1:20 appointment, just because I'd rather do it on an empty stomach.
Right. Years ago, when as a sales guy, I go into people's houses, and a woman said that she had 14 dogs and like 12 cats or something like that. And I had to go around and measure up different rooms in the house for sizing of the equipment. And so I'm going around and I open up her door. I said, can I open up this door to measure this room? She's like, sure. I opened the door and that smell hit me of all the animals.
Yeah.
I just start dry heaving. And I'm like, ah. So smells, man. If I'm opening, somebody's like, hey, look at this pus on this boil, and I couldn't. I would lose it.
Yeah.
So.
I've had some people have to walk out of rooms on certain things. I haven't gotten to that point yet, but yeah, there's been a couple times where I'm like, okay, that hit me a little more than I thought it was going to.
So let's go. I do a section called deep diving where I kind of dive deep in a little bit. So do you have a story about losing a contact lens?
I do have a story about losing contact lens. So I do colonoscopies, and I was usually colonoscopies are pretty clean procedures just because the person is cleaned out. And I was doing one, and it wasn't that clean of a procedure, and a lot of liquid was coming out of the patient onto the table. And sometimes when I'm doing those, it's kind of like if you're ever playing a video game or you're like engrossed in a movie and you forget to blink, you're just kind of staring at something. And I could sense that my contact was getting dried out. And I knew I wasn't going to be able to save it. And of course, I can't use my hands because they're occupied. And so I tried to blink it out in my eye onto my shoulder, And sure enough, it blinked onto my shoulder, rolled down my arm, and landed right into this puddle of brown liquid, we'll call it.
Yes.
And the problem was, this was like on a Monday morning at like 8 o'clock. I had a full day of clinic after that, the same location. I didn't have a spare pair of glasses or a spare pair of contacts. I can't see well enough without contacts. I really had no choice. And the hospital's 40 miles from my house. So like I have really no choice in this situation. So I think through my options, and really the only option I have is to put the contact back in my eye. So I asked the anesthesiologist in the room, do you have a saline flush? And I flushed the saline over that contact as much as I could. And I just put it back in my eye and went about my business. So, and as far as I can tell and remember, I never, no eye infection or anything. I did throw that contact away when I got home. And now I have a spare pair of glasses in my car at all times.
See, you learned. It was a lesson.
I did. Fool me once.
Yes, absolutely. All right. So speaking of that disgusting thing, I'm going to go to like food. So do you have a hatred for the Golden Corral?
I'm not a fan of the Golden Corral. My kids like it. I think they like any buffet, but for some reason they like the Golden Corral. And I don't find myself to be a food snob. I'll eat pretty much anything. But something about rolls. Exactly, I had pizza rolls. I'm not I'm not opposed to eating cheap, salty, processed foods. But it was it's just something about the whole thing. And I think part of it as a physician, and I'm not a judgmental person, but when I walk in there and I see, very large people with like multiple plates of very bad for you food, and then just realize that like this, like back to one of our earlier questions, like they are not being compliant with what their physician has asked them to do. And I think my kids, we let them pick where they want to go for their birthday. And for a few years, I'm sure my two oldest picked Golden Corral just to spite me. I don't think they liked it nearly as much as they played. I think they knew that it would be the only time I wouldn't trump them and tell them no, because it was their birthday. And so this year, thankfully, we've made it through birthday season without having to go to the Golden Corral. And now because of the coronavirus, I have one kid's birthday left and it will be closed by then. So we can't go then either. So darn.
Yeah, I can tell you're upset. All right. This part of the interview is I have an Eagles hat here since I know you're a Vikings fan, but it's would you rather. I reach into the hat. There's different questions, just totally random, and now you got to answer them. So Your question is, A, would you rather be stuck on an island all alone, or B, stuck on an island with someone who won't stop talking?
A.
Yeah, I actually knew that as soon as I pulled this one out. I was like, I know that.
I'm an only child. I'm used to being alone. I've been prepared for that my entire life.
Okay. So right now, you're being on the front lines. What can we pray for you in your life? What's something that we can actually,
I think that it's obviously protection. To not get the virus is not just an old person. I don't really know why some people respond so negatively to it and versus others. So obviously protection. And I think, wisdom, as in everybody's job field right now, there's a lot of volatility. And, people would think, people who are in the medical field, their jobs are not at risk in this. And that's actually not true, because those of us who are not emergency room doctors or ICU doctors, like I said, all of a sudden my clinic went from 25 to 10 in a day. And so the people I work for are looking and going, well, you guys aren't generating near the revenue. Okay. And so there are doctors all over the country that are actually getting laid off and, are losing their job or are being told that, but a lot of times they're under contract. So they're pretty much being laid off because they can't see anybody and produce any revenue. So they're not getting paid, but then they also can't go look for a job at a place that needs them because they're contractually obligated to who they are working for, even though they're not getting paid. And so people are getting trapped. And then, and on top of all that, the staff, and I feel very responsible for the staff at my clinic. And so I feel bad because a lot of them, their husbands have been laid off because of what's going on. So they're the primary breadwinners. They're it's not particularly high paying jobs. And now we're saying, hey, we need you to cut back, 5 hours a week or 8 hours a week. And now there's this concern of, I'm not going to be able to pay the rent. Right. And so it's those prayer requests that's more for the staff in the medical field in general, not physicians. I mean, we do pretty well regularly. So, I mean, I think at this point, like, if we wind up not getting paid for a couple months, we should still be able to make ends meet. But there's a lot of people that work in the medical field that if they have to be off for a month and a half, that could be disastrous. And so, just fields, I mean, people are it's scary. It's scary no matter what field you're in. And, so just that level of unknown, of not knowing what the next day is going to hold. I have a conference call coming up Monday night with my employer, all the physicians, because they want to talk about consolidating practices and putting different doctors' offices together, mainly so they can streamline staff. Well, I know what that means. If they do that, then people that work at my office, because Dr. McCleary has been moved to a different office, so we don't need you until this is done, and so those are the concerns that I have, as a leader, is, for my people. And I would say that's a big prayer request.
Okay. Now, we had Facebook Live for the Wednesday night prayer meeting at church. That's how Pastor Vince and Pastor Greg did that. And your father was brought up for.
Yes.
So he just suffered a heart attack.
Yeah. So Tuesday morning he had some pretty significant chest pain. He had been having off and on chest pain for a few months, and it seemed like it was more acid reflux. Tuesday morning it came on much stronger, and he had what turned out to be a massive heart attack Tuesday morning. And honestly, I talked to the heart doctor on Thursday, and she kind of gave me the details of what they saw when they took him into the heart cath. And it's a miracle that he survived. It was really pretty massive, and survived. The concern now is he lost about half of his heart function with that, and so his heart's, like I said, only going about half what it should right now. So the big prayer request with that is that that will start to bounce back, and that's we won't know until it takes about 3 months before they're going to recheck. So for the next 3 months, we have to watch closely and make sure things are going along okay. And then hopefully 3 months from now, they'll recheck and that function will be up, and, he'll be able to kind of resume normal activity at that point. But it definitely was a scare, definitely a reminder of how fragile and short life is. And also, like, no matter how much you know about something, I do this for a living, you're still helpless, when those situations happen. And so, just very humbling and sobering, but also incredibly thankful that, it was just a scare, and it wasn't something that wound up being, deadly.
Right. Well, we'll keep him in our prayers. And thanks so much for joining us. Make sure you say hi to Holly and the kids for us. And it was awesome having you on here, man.
Well, thank you for asking me. I had a lot of fun, and I appreciate you doing this and making people feel connected while we're all stuck trying to hide from each other. So I think it's a great idea.
I do the best I can.
But and you do well, Bill. So thanks very much, and you have a good day and stay safe.
Thanks, buddy. I'll talk to you.
All right. Bye.